Hello everyone, welcome back to another live stream. र आजको लाइभ स्ट्रिम चाहिँ सबैको लागि डेडिकेट भएर आई लाइक टु स्पिक इन इङ्ग्लिस मोर होइन। सबैले बुझ्नु पऱ्यो है, अलिअलि नेपाली पनि बुझ्नु पऱ्यो। फेरि इन्डियन स्टुडेन्टहरूले चाहिँ नेपाली नबुझ्ने भएर चाहिँ अप्ठ्यारो हुन्छ है। मेनली आजको लाइभमा चाहिँ आज मतलब पढ्ने भन्दा पनि आज चाहिँ मतलब कसरी क्वेसनहरू एन्सर गर्ने र मेनली इम्पोर्टेन्ट क्वेसनहरू के छ भनेर चाहिँ हामी डिस्कस गर्छौँ। मेनली आज चाहिँ तिनवटा सब्जेक्टको है, एनाटोमी, फार्मा र प्याथोको डिस्कस गर्छौँ हामी। आज चाहिँ मेनली वी आर गोइङ टु डिस्कस एबाउट सम एन्ड एनालाइज एबाउट सम पास्ट क्वेसन्स र पास्ट क्वेसन र अनि रिपिटेडली सोध्ने टपिकहरू, इम्पोर्टेन्ट टपिक्स वी आर गोइङ टु डिस्कस टुडे। सो waiting some time, wait, and we'll gonna start from the anatomy and then we'll move on to pathology and then we'll move on to pharmacology, and for today it will be great with the three topic है। सबैजनाले यस्तो हो, तिमीहरू तिनवटा टपिकको बारेमा आज भनिदिन्छु अनि त्यसपछि तिमीहरू 15 मिनट पायो नि त टाइम। तिनवटा टपिक मैले भनेको टपिकहरू चाहिँ फर्स्टमा सकिहाल्नु, त्यसपछि टाइम बच्यो भने चाहिँ अरू टपिकहरूलाई मजाले पढ्नु। त्यो मैले आज भनिरहेको टपिकहरू होइन, द टपिक जुन चाहिँ सिलेक्टिभ टपिकहरू मैले आज भनिदिनेवाला छु, त्यो टपिकहरू चाहिँ नछुटाउनु। फर्स्टमा फेरि मैले त्यो भन्न खोजेँ होइन कि जस्ट लाइक कि रिड द्याट टपिक ओन्ली, बट डोन्ट मिस आउट दिस टपिक। आज मैले भनिरहेको टपिकहरू चाहिँ है, द टपिक टुडे आई एम मेन्सनिङ, डोन्ट मिस आउट। मेनली फोकस अन द्याट अफ फर्स्ट एन्ड देन सेट युर प्रायोरिटिज एन्ड देन मुभ अन टु द अदर टपिक्स। फर्स्टमा चाहिँ हाम्रो होइन, यसमा जेनरल ब्लकको लागि आई हेभ डन सम एनालाइसिस अन द्याट। जेनरल ब्लकमा कस्तो कस्तो क्वेसन सोधिरहेको छ, पास्ट इयर क्वेसन, त्यस्तो पास्ट इयर क्वेसन आई एम एनालाइजिङ and some important topic. There are some like pattern in the questions, okay, that they are giving some questions on the basis of like anatomy. It is a sure question from the development है, डेभलपमेन्टबाट एउटा क्वेसन आउनु त स्योरै हुन्छ। त्यस्तै गरी फिक्स, देयर आर सम फिक्स पोर्सन द्याट विल गिभ यु सम मार्क्स है, इट विल हेल्प यु टु पास द जेनरल ब्लक। जेनरल ब्लक पास गर्न इट इज फर्स्ट थिङ, यु आर न्यू टु द दिस field, so it will be a little bit hard for you first. After passing, after going moving on to the MSK, you will feel much easier in the general block के आफूले पास आउट भइसकेपछि चाहिँ जेनरल ब्लक चाहिँ एकदमै सजिलो लाग्छ। सो आजको मेन है, द मोटिभ अफ दिस लाइभ स्ट्रिम इज टु सेन्सिटाइज यु मोस्ट इम्पोर्टेन्ट and most frequently asked questions from the general block. Mainly today we are going to discuss this. This live will be in two part. I know today we are going to discuss about the anatomy, pharmacology and the pathology, and I am pretty sure that most of the question will be from the topic and questions. I will mention some questions and I will provide you the notes for the question and I will provide you the answers for the questions also. But for today and tomorrow, I am going to mention the questions only. Okay, I would like to mention the questions only and topics only. So you will be thoroughly reading that topic first. Right? Prioritize the topic first and then we are going to move on to the answer also. I will teach you how to write answer, how to manage the time, everything. I will teach you after you have exam in 2. I will make you ready up to like 29. Okay, है, त्यतिसम्मलाई चाहिँ सकौँ। 29सम्म सक्यो भने पनि यु हेभ मच टाइम टु रिभाइज है। फर्स्टली चाहिँ हाम्रो विल गो फ्रम द एनाटोमी एन्ड विल गो टु द प्याथोलोजी देन टु द फार्माकोलोजी है, एन्ड विल मुभ अन लाइक द्याट। And for the access of the drive, okay, I have to give an individual access दिनुपर्ने छ। सबैको इमेल त मैले पाइसकेको छु, तर एकजनाको त क्लिक गर्नुपर्छ कि सेयर एक्सेस गर्नुपर्छ। सो सबैको एकचोटि बल्कमा गर्न खोजेको थिएँ मैले, त्यो चाहिँ अलिकति गुगलको सर्भर के भइरहेको छ खोइ थाहा भएन, त्यो भएर इट इज लिटल बिट स्लो। सो त्यसले गर्दाखेरि त्यसले चाहिँ रेन्डरै गरिरहेको थिएन इमेलहरू, इट इज नट रेन्डरिङ द इमेल। सो आई लाइक टु है कन्फर्म द्याट कि today after the midnight you will get the access, everyone will get the access of the that drive that contain all the necessary study material for the first year. Okay, now we have waited some time Wait, let me check. Okay. Uh, we will continue from the anatomy. Okay, anatomy, or okay, starting from the pathology, because we have studied the pathology series. So from the general pathology. Okay, today I'm not going to teach you, but I like to tell you some important questions. I like to sensitize about some important topic. You must read first. Okay, this might say about little bit. I'm not comfortable like speaking in English a lot, so I'll be little mixing up Nepali. त्यसमा चाहिँ अलिकति माइन्ड नगर्नु. Okay, don't mind. From the pathology, we are starting from the pathology first, because we have already started around 2 sessions. Half of the pathology is almost completed, because we have done up the inflammation and chronic inflammation is remaining. We'll continue this after this question analysis session. So mainly today's focus is the for mainly today's focus is for the question answers, right? Question answers, mainly focus on this topic. I like to see, okay, focus on this topic first, and then move on to the other topic if you have times. But don't leave this topic, right? Don't leave these questions. Mainly I am giving you the questions, so don't leave these questions. Okay. Now let me check the connections. Everything is okay. Now I am going to start about the questions. Wait a sec. Okay, everything is good. I have already checked. Okay. अब मैले चाहिँ हल्का नेपालीमै भन्दा हुन्छ होइन, नेपालीमा भन्दा तिमीहरू राम्ररी बुझ्छ के भन्न खोजिरहेको छु मैले. जस्ट त्यो फेरि इङ्ग्लिसमा भन्नु पर्दाखेरि अब फेरि इन्डियन स्टुडेन्टहरू पनि छ होइन, तिनीहरू नबुझ्न सक्छ. द्याट विल बी लिटल बिट अब कन्फ्युजिङ हुनसक्छ तिमीहरूको लागि होइन. फर द फरेन स्टुडेन्ट इट विल बी लिटल बिट कन्फ्युजिङ, बट मेनली आई वान्ट टु डेडिकेट दिस भिडियो टु द फरेन स्टुडेन्ट, बिकज दे विल बी ह्याभिङ हार्ड टाइम पासिङ द इक्जाम्स है. बट if you study hard only, it will be not like not sure you will pass the exam. But if you study smartly, right, you will first do the topic that I told, or that I'm going to tell, and after that move on to the other topic if you have time, right? You are confident in that topics and that questions, and then move on to the others, right? अब मेनली चाहिँ मैले अब नेपाली नै युज गरेर भन्छु, किन भन्दा यो बुझाउनलाई गाह्रो हुन्छ. इङ्ग्लिसमा बुझाउनु पऱ्यो भने आइएम नट हेबिचुअली लाइक के टकिङ इन इङ्ग्लिस है. आई क्यान डु द्याट, बट तिमीहरूलाई अकवर्ड लाग्छ मेरो इङ्ग्लिस सुनेर है, मेरो इङ्ग्लिसमा बस्छ है. सो फर्स्टमा चाहिँ अब ग्रानुलोमा इन्फर्मेसनको कुरा गर्ने भने, इन्फर्मेसन फ्रम द इन्फर्मेसन यु विल बी गेटिङ मेनली 3 टाइप अफ क्वेसन्स यु विल बी गेटिङ. मेनली फर्स्ट क्वेसन इज लाइक the mainly I have already told the definition is very important for all the topics है. जतिवटा टपिक छ सबैको डेफिनेसन चाहिँ रट्दिनु है. सबैको डेफिनेसन फ्रम यु क्यान लिटरली टेक द माइक्रो सिलेबस इन योर ह्यान्ड, एन्ड whatever sub topic you have seen, just right, get the definition right. Get the definition from no, it would not like your definition, layman definition, you will not get full marks. If there is every question they are asking definition at first, and there will be the tail question 3 marks. Like mainly pathology, they focus on the definition mainly 1 plus 3, they are giving like marks like 1 plus 3 1 plus 3 गरेर दिइरा हुन्छ धेरै जस्तो चाहिँ हैन. सुरुमा चाहिँ डेफिनेसन सोधिरा हुन्छ है, डेफिनेसन धेरै सोध्छ. अनि डेफिनेसन चाहिँ तिमीले के गर, माइक्रो सिलेबस लिगो. I will also be giving the micro syllabus also है. त्यसको लिंक भित्र माइक्रो सिलेबस पनि छ, त्यो ओरिजिनल पीडीएफ छ, त्यहाँबाट हेर्दा हुन्छ. Okay, from there you can have a look. अनि त्यसमा चाहिँ pathology, for the pathology you can study every definition you find from the Robbins, not from other book, because everyone loves Robbins. Pathology literally they say Robbins is pathology and pathology is Robbins. Okay, you can use Robbins for the definition. Standard definition, you have to write standard definition. You can modify some word, but it is better to know the standard definition, because they will give marks for the standard definition. Right? They will not think before giving marks. If you write from the Robbins, they will give full marks. Right? Tesma, if it is coming for 1 marks, you will get the 1 marks completely. But if you use your language, if the teacher did not get the keyword there will be the keyword in every answer. There will be the keyword. If the teacher will not find the keyword in your definition. If the definition is totally correct, but if the teacher is not finding the keyword that she is looking for, you will not get the totally full marks. If around in the 1 marks question, you will get like 0.5, 0.75 you will get, but you will not get the full mark. If you write from the Robbins, you will get 100% marks. Okay. So I would like to tell you that definition ko lagi you should prefer the Robbins. Pathology सबैको लागि Robbins प्रिफर गर्ने, तर भनौँ न स्लाइडहरु हेर्दा पनि हुन्छ, तर मेनली डिफिनेसन को लागि चाहिँ Robbins बाटै पढ्दा हुन्छ है। त्यसपछि फ्रम द इन्फर्मेसन टपिक, इन्फर्मेसनबाट चाहिँ मेनली लर्न द cellular event and vascular event. If you are finding in art, I already made the video for the up to the acute inflammation, cellular event and vascular events. You may have a look on that. But if you are still having a hard time learning the inflammations, that cellular event and a vascular event, just है त्यसमा चाहिँ त्यसो भएको इभेन्टहरु जुन चाहिँ छ, there are some steps, just know them. Right? Just you should know the names of the step and little bit info about them. If you write that, if the question is coming for the 4 marks, you will get 3, 2.5 easily you can get. Okay, just not like leaving it blank. If it is you are finding it hard, don't leave it totally. Just read the steps for the inflammations and read little bit in the layman word. It is okay. Description in the layman word is okay. Okay, this is हल्का तिमीहरु सबै स्टेप पढ हैन, सबै स्टेपहरु पढ। स्टेपको नाम पढ्न त के गाह्रो छ र, जस्ट बुझेर पढ, सबै स्टेजहरु पढ। स्टेप पढिसकेपछि चाहिँ त्यहाँबाट चाहिँ जस्तो सेलुलर इभेन्ट मेनली दे आर आस्किङ फर द भास्कुलर इभेन्ट आर मेनली आस्क्ड रादर देन द सेलुलर इभेन्ट है। भास्कुलर इभेन्ट धेरै सोधिरा हुन्छ, भास्कुलर इभेन्ट अफ द एक्युट इन्फ्लामेसन अथवा भास्कुलर इभेन्ट अफ द इन्फ्लामेसन भनेर सोधिरा हुन्छ। त्यसमा एटलिस्ट तिमीहरुलाई पुरै एक्सप्लेन गर्न आउँदैन भने पनि एटलिस्ट यु शुड नो द स्टेप्स। जुन त 5 वटा स्टेप छ, 5 वटा जुन त पोइन्टहरु छ, त्यसलाई चाहिँ जान, त्यसलाई चाहिँ त्यो के गर भन्दाखेरि नो देम, जस्ट नो देम, रड देऊ नत्र आउँदैन भने घोक्देऊ। त्यसलाई चाहिँ घोकिसकेपछि चाहिँ अब अर्को काम के गर भन्दाखेरि त्यसलाई बुझिसकेपछि घोकिसकेपछि त्यहाँबाट चाहिँ अलिकति डिस्क्रिप्सन चाहिँ एड गर, आफ्नै ल्याङ्ग्वेजमा एड गर। जस्ट लाइक कि के हुन्छ सुरुमा के हुन्छ, ट्रान्जिएन्ट भ्याजो के हुन्छ, कन्स्ट्रिक्सन हुन्छ, त्यसपछि पर्सिस्टेन्ट भ्याजो डाइलेसन हुन्छ। त्यसरी नै के अब ट्रान्जिएन्टली भ्याजो कन्स्ट्रिक्सन भएर ब्लान्चिङ देखिन्छ। त्यस्तो गरेर थुप्रै सर्ट डिस्क्रिप्सन अराउन्ड 1 to 2 लाइन डिस्क्रिप्सन यु शुड नो and you will get the just like if they are asking for 4 marks, you will get 3.5 easily, because the question is asking for the steps. You are giving the step and little bit description. Or if you want full marks, you have to write everything about that. Describe पनि गर्नु पर्यो, चित्र पनि बनाउनु पर्यो है। and pathology they prefer flow charts बनाउन आउँछ, पोइन्टमा लेख्न आउँछ भने you should like not like writing in the paragraph. They prefer flow chart. If you prefer writing in the paragraph, you should be using like underlining the keywords. You should be knowing the keywords that teacher will be searching for that keyword, not like writing the paragraph, it will be the mess. Okay, so prefer using the point method and the flow charts. Right? Flow charts चाहिँ use गर्न prefer गर्नु। अर्को चाहिँ अब त्यसबाट दुईटा इन्फर्मेसनबाट त्यो दुईटा सोध्न सक्छ र त्यसपछि ग्रानुलोमा इज इम्पोर्टेन्ट है। क्रोनिक इन्फ्लामेसनबाट एउटा सोध्न सक्ने भनेको ग्रानुलोमा। द कन्स्टिट्युएन्ट अफ द ग्रानुलोमा इज भेरी इम्पोर्टेन्ट एन्ड you will be studying that on the hypersensitivity topic also, type 4 hypersensitivity. It is granuloma literally. Okay, so you should be knowing the granuloma and the constituent of the granuloma, or mainly it can ask like write the morphology of the tuberculosis, not like directly asking for the chronic inflammation. It may ask saying for the granuloma or tuberculosis. It may ask from the any point of view, but it is asking really for the granuloma. How is the granuloma form, or what does the granuloma consist of? Okay, and from the cellular adaptation and cell death, you should be knowing the type of the necrosis, definition of the necrosis, and the pathway for the apoptosis and definition of the apoptosis. Mainly they are not like asking differences a lot, They are not asking the morphology of all of them a lot, but you should know the type of the necrosis with a little knowledge of the morphology also, and you should know the apoptosis, and the pathway is very important because they are asking the pathway many times they have asked. Okay, and from the uh, neoplasia, from the neoplasia, mainly they are asking of the difference between the benign and the malignant tumor. Benign and the malignant tumor, you will get a table in the Robbins. You can find the table in the Robbins. There is a table, and you can read from there. So for the ट्युमर है बिनाइन र मेलिग्नेन्टको लागि चाहिँ त्यही रोबिन्समा चार्ट दिएको छ, त्योबाट पढ्दा नि भयो। नत्र भने आफैलाई सजिलो लाग्छ भने आफैले चार्ट बनाएर त्यसमा डिफरेन्स लेख्नु, मेनली अब जस्तो सेपहरू, साइजहरू, अनि त्यसको मेटास्टेसिस गर्छ गर्दैन हैन, ओरिजिनहरू के हुन सक्छ, इक्जाम्पल्स यु शुड नो दैट। अनि एटलिस्ट यु शुड नो अराउन्ड 8 to 10 points you should know about the difference between the benign and malignant tumors. And from the other question from the tumor that is important is the mechanism for the metastasis and the root of the metastasis. It is very important. There is the clear flowchart given in the Robbins also, given in the fast track also. You may read from anywhere, but read like understanding. सबै अब बुझेर पढ्नु त्यो चाहिँ एकदम इट इज लाइक अ स्टोरी, सुड रिड इट लाइक अ स्टोरी, नट मेकिङ अ नट लाइक कि त्यो नबुझी चाहिँ नपढ्नु त्यो चाहिँ है। त्यही भएर मेटास्टासिसको मेकानिजम इज भेरी इम्पोर्टेन्ट, and mechanism for the metastasis and the root of the metastasis, which tumor take which route, like hematological and lymphatics and the transcelomic route. There are many routes, so they may take which tumor may take which route, you have to explain है। त्यो कुराहरु चाहिँ इम्पोर्टेन्ट छ हाम्रो न्यूप्लेजियाबाट। एन्ड if you have time you may also read the gene related to cancer or tumor suppression gene and the proto-oncogenes, like there it is a little bit confusing topic, but you may read है। त्यो चाहिँ सोधिरहन नै हुन सक्छ, तर just you if you have having a hard time learning about the tumor suppressor gene and proto-oncogenes, you may just know about 2-3 like T53 and the retinoblastoma. They are just easier one, and learn about them and don't go in detail now because it last बेलामा चाहिँ पुरै डिटेलमा त नपढ, तर एउटा दुटा एक्जाम्पल एन्ड एउटा दुटाको डिस्क्रिप्सन चाहिँ जानिराख, बिकज दे क्यान आस्क इन द सर्ट नोट, सो यु शुड बी रेडी फर द्याट अल्सो है। त्यसपछि अर्को सोध्न सक्ने भनेको चाहिँ के सोधिराखेको छ भने दे आर आस्किङ फर द प्यारानियोप्लास्टिक सिन्ड्रोम। प्यारानियोप्लास्टिक सिन्ड्रोम you should know about at least 4 to 5 paraneoplastic syndrome examples, like and definition of the paraneoplastic syndrome from the Robbins, that the syndrome associated with the tumor that cannot be explained by the physiological anatomical site of the tumor and metastatic site of the tumor, this is the definition is like that. And paraneoplastic syndrome, you should also know about how the paraneoplastic tumors show the paraneoplastic syndrome. There are literally 3 mechanisms that like तीनटामा चाहिँ एउटामा the tumor may produce the metabolically active substances. It may mimic some hormones, biologically active substances like hormone like peptides. It may be forming the intermediate product from the metabolic pathways like glycolysis मा G6PD हरु बनाइदिन सक्छ हैन। It may be forming immunologically active substance also, that they can form antibodies and antigens. They can form anything, so that will lead to some symptoms that is known as the paraneoplastic syndrome. You have to read in detail about that because they are asking for the paraneoplastic syndrome mainly in the short notes, or may ask in the short question. And further and read the pathogenesis of the HIV and AIDS. HIV/AIDS, you should know the pathogenesis, how virus enter into the body, how they replicate, which cycle they follow. You should know all the things about the pathogenesis of the HIV/AIDS. It is very important. Okay, I will don't worry. I will write the questions in the board also, so you will be getting it easier. Okay, and about AIDS, you should be knowing the pathogenesis. Pathogenesis of the AIDS is very much important, and you should be knowing the opportunistic infection and tumors that can be associated with the AIDS. एड्स लागिसकेपछि चाहिँ लाग्न सक्ने अपर्चुनिस्टिक इन्फेक्सनहरू कुन रोगहरू लाग्न सक्छ र कुन ट्युमरहरू चाहिँ सजिलै देखिन सक्छ एड्स लागेको मान्छेलाई, त्यो कुराहरू चाहिँ हेर्नु पर्यो है। त्यो कुरा चाहिँ इम्पोर्टेन्ट। एन्ड फ्रम द हाइपर सेन्सिटिभिटी, you will be getting the definition from the hypersensitivity, and type 1, 2, 3, 4 you have to read it all. It is not a long topic, but if you understand it's not long, but if you do not understand, if you have to go like thoroughly recite everything sabai bhognu parne cha bhane chai it will be very big topic for you. Immunity chapter, it will be very big topic for you. But if you learn like story, pathology is just like story. If you learn like it and remember everything, just type 4 hypersensitivity मेरो पढ्नै पर्दैन किन भन्दा it is totally same. Granuloma, it is granuloma formation, type 5 hypersensitivity. And type 1, 2, 3 is similar about similar छ. त्यसमा चाहिँ बुझ्नुपर्ने कुराहरू छ अलिअलि, त्यो चाहिँ बुझ्नुपर्छ है. टाइप हाम्रो पास्ट क्वेशनमा चाहिँ टाइप 1 एन्ड दे आर इन्ट्रेस्टेड इन टाइप 1 एन्ड टाइप 2 हाइपरसेन्सिटिभिटी. प्याथोजेनेसिसमा लाइफ साइकल र सप्रेसन अफ टी सेल्स दुवै लेख्नु पर्ने हो. के को प्याथोजेनेसिसमा फेरि भन्दा हुन्छ के को प्याथोजेनेसिसमा? त्यसको प्याथोजेनेसिस त मैले बुझेँ. प्याथोजेनेसिस केमा? एड्सको प्याथोजेनेसिसमा दुवै लेख्नुपर्छ. एड्सको भन्दा हो भने दुवै लेख्नुपर्छ, तर सर्टमा लेख्ने. जस्तो सप्रेसन अफ द टी सेललाई धेरै फोकस गरेर, किन भन्दा टी सेलले चाहिँ के भन्छ भन्दाखेरि के टी सेलले चाहिँ के गर्छ, टी सेललाई चाहिँ मेनली टी सेलको लागि के गर्दैन, टी सेलको फङ्सनलाई सप्रेस गर्ने हो नि त. त्यही भएर जस्तो भाइरस कसरी छिल्छ अनि कसरी छिलिसकेपछि चाहिँ कसरी मल्टिप्लाई गर्छ, ग्रो गर्छ, अनि त्यसपछि फेरि त्यसले गएर चाहिँ अब इम्युन सिस्टमलाई कसरी सप्रेस गर्छ सम्म लेख्नुपर्छ. त्यसले गर्दा के एफेक्ट देखिन्छ, जस्तो डब्ल्युबिसी काउन्टहरू घट्ने यताउति देखिन सक्छ, त्यो कुराहरू लेख्नुपर्छ एड्सको प्याथोजेनेसिसमा चाहिँ. अनि अपर्चुनिस्टिक इन्फेक्सनहरूको बारेमा लेख्नु पर्यो भने चाहिँ जस्ट यु मे लिस्ट आउट सम नेम्स र अनि अलिअलि डिस्क्रिप्सन दिइदिने हो, अरू त केही नै गर्नु पर्दैन होइन. अपर्चुनिस्टिक इन्फेक्सन अफ एड भन्यो भने अपर्चुनिटी यस्तो हुन्छ, इम्युन सप्रेसन हुन्छ. इम्युन सप्रेसन भइसकेपछि जस्तो नर्मल्ली लाग्नुपर्ने लागेर सन्चो हुने रोगहरू पनि लङ टर्मसम्म पर्सिस्ट गर्छ होइन. जेनरली हाम्रो थाहा भएको कुराहरू नै लेख्ने हो कि. अनि त्यसमा चाहिँ अर्को कुरा के लेख्नुपर्छ भने त्यसमा ट्युमरहरू छ, जस्तो हजकिन लिम्फोमाहरू जस्तै ट्युमरहरू केवाला ट्युमरहरू छ, त्यो चाहिँ इम्पोर्टेन्ट छ. त्यो कुराहरू लेख्नु पर्यो है. अर्को चाहिँ अब यसपछि from the immunity chapter, autoimmunity and its mechanism are very much important. The breach of the tolerance is the autoimmunity. अब tolerance को बारेमा जान्नु पर्यो. tolerance लाई breach गर्ने mechanism, there are some mechanism, there are 4 to 5 mechanism for the autoimmunity, like breach of the synergy, molecular mimicry, like that. You have to know at least. If you are having problem learning the all the whole topic, just take the important topic only. Okay, take the questions. I will give you provide you the questions later on, or I will provide you through your CRs. Okay, I will give it to them. I have sorted some questions. I will give it to them, and you all will get the questions. है त्यो त पाइ नै हाल्छ तिमीहरुले. त्यसमा पनि फर्स्टमा I am not telling कि read the questions only like that, not है. यसमा क्वेशन मात्रै पढ भन्न खोजेको चाहिँ यो मात्रै पढ भन्न खोजे होइन. जस्ट फर्स्ट प्रायोरिटी दिएर चाहिँ यसलाई पढ, त्यसपछि चाहिँ अरु पढ्नु. यो एक्जाम विल बी ग्रेट. पास गर्नलाई अनि राम्रो नम्बर ल्याउनलाई चाहिँ सजिलै पास भइ नै हाल्छ त्यति भयो भने है. अनि mainly focus on the questions first. Okay, the question I am telling you, mainly focus on the question first, and then you will continue the other things after that. है अब त्यसपछि चाहिँ mainly अब हाम्रो autoimmunity को चाहिँ definition चाहियो. Definition for the autoimmunity, like breach of the tolerance and all that, from the Robbins you have to read. And for the mechanism of the autoimmunity, there are some points, and you should know the tolerance first. If you like to understand the whole topic, you have to know about the tolerance, how the tolerance mechanism working in our body, and then the breach of the tolerance or breakdown of the tolerance is the autoimmunity. Right? The breakdown of the tolerance, or if you don't want to learn the whole topic, if you are in a rush to finish out the, if you have rushed to finish out all the topic, okay, you are not getting the heck of anything. So like if you are panicking, just read out the important questions, and like if you have time, revise them, but just be confident in these questions, and you will pass easily. Okay, just be confident in the question first, and then autoimmunity पढाउनु भएको छैन हो. Okay, autoimmunity, if autoimmunity is not taught, then the question will be not coming from that, but it is important topic. If it is taught, then the one question will be sure from the autoimmunity. Actually मलाई भन्दै त कहाँसम्म पढाउनु भएको छ pathology, just tell me that last topic taught from the pathology, tell me, write in the comments. Last topic taught from the pathology. I'm waiting for your comment. Amyloidosis, have you not taught the immunity part, or it is left? Amyloidosis, amyloidosis is the last lecture, I think so. So the autoimmunity should have been taught already. Okay, it is if it have not been taught, then the question will not come from there. But एमएलओसी सम भइसकेपछि चाहिँ त्यो अटोइम्युनिटी हुनुपर्ने थियो है, त्यसमा अब के गर्नु भएको छ त्यो आई डोन्ट नो, बट जेनेटिक्स भयो कि नै, they have the genetics, have you taken like that familial hypercholesteremia, Turner syndrome, Klinefelter syndrome, Down syndrome? Have the lecture been taken or not? Tell me, just leave the comment. I am reading it. Okay, I'm seeing the comment. Okay, I'm leaving the genetics also for now until someone tell me if it haven't been taught. I'm not going in detail about the genetics, but you have to read literally read the genetics for the anatomy itself. Anatomy मा त सबै पढाइ भइसक्यो होला नि, इम्युनोलोजी सकिएको छ तिमीहरुको, मलाई त थाहा छ. So for the genetics, if it is not taught in the pathology, you have to literally read in the genetics. Done. Okay, done. Genetics, if you have read the genetics, then there will be questions from the chromosomal abnormalities, like how the mutation happened. It is the same, totally same from the anatomy. In the anatomy, I will go in detail about the genetics, and from the genetics there is new questions like maybe coming. It is all of the them same, like Turner syndrome, Klinefelter syndromes, right? Patau syndrome, Down syndrome. It is all the same. Marfan syndromes, like this will come from the. Okay, it is the same from. So it is similar to the similar, not like just it is totally same for the anatomy. The answering way is different. You have to write about the pathogenesis and a little bit about the clinical feature here, but in the anatomy you have to write totally about the karyotyping and the clinical feature only. And what is the effect or applied aspect for that, you have to write that. But in the pathology you have to write little bit differently on this. Okay, you have to write about the pathogenesis, in which arm it is affecting, like that arm PQ, about the short arm and long arm of the chromosome. And karyotyping, you have to write the karyotyping. If you don't know about the genetics detailedly, you have to at least know about the karyotype of the disease, like Down syndrome. You have to know the karyotypes, you have to know the clinical features, you have to know the pathogenesis, little bit about the pathogenesis, how it happen, which type of mutation will be happening in there. Okay, which type of mutation will lead to the Down syndrome, the mosaicism, like that. Okay, and which type of mutation, and you have to know a little bit about this. For the pathology point of view, you have to know the pathogenesis little bit, but for the anatomy point of view, you just read about the karyotype and for the clinical feature, and what will happen to the, just like it will survive or not in the child stage, or it will survive till this date, like you can know about that only. We will be talking that in the anatomy also, right? Anatomy and कुरा गर्छौं र यसपछि from the cellular adaptation and cell death, I have already told about the cell death, but from the cellular adaptation, all the 5 adaptations are totally important, and mainly they are asking about the metaplasia and the atrophy the most. They are asking for the metaplasia and atrophy, but they can ask literally any thing from the adaptation, because it is easy, and you should at least know the definition of the adaptation. You have to know the examples, two pathological example, two physiological examples. If there are the type, like in the atrophy, there are type diffuse atrophy and senile atrophies, and there are type of the atrophies that you have to know the type also. Now, not in detail, but you have to know which type of atrophy was what. Like just like diffuse atrophy, if you diffuse some organ for a long period of time, there will be the decrease in size of the organ. So you should know a little bit about that. You should have layman knowledge about that. Then you will get the marks. Okay, and you should know at least two pathological and at least two physiological example of all the type of the adaptation, like metaplasia, dysplasia, atrophy, hypertrophy, and uh, and and hyperplasia. Like you have to know at least two physiological, two pathological example of that, and you should know the mechanism also, mechanism a little bit about the mechanism of the all the adaptation, like hypertrophy, how does it happen, and it is easier, it is given easily in the fast track, right? Just to refer to the fast track, it is given in the first phase, literally in the first phase, cellular adaptation. In the, I think so, in the rightmost uppermost corner it is given. So read from there. There is a written about the for the mechanism of all the adaptation. They have given the short 1 to 2 point. Just you can know about them, and if you want to go in detail, refer to the Robbins. Okay, and for the embolism or hemodynamic chapter, they are very interested in embolism and mechanism of the ER embolism. If they are asking for the embolism, they will always ask for the ER embolism, and definition of the embolism is important. And for the okay, and visual triad is important. That is the pathogenesis of the pathogenesis for the that visual triad. There is three things that lead to the thrombus formation. It is very important, like hypercoagulability, and like endothelial injury. Like there are three things that will lead to the thrombus formation and may lead to the thromboembolism. You have to know about that. And they are interested in, I have already told, they are interested in the metaplasia. Short note, they are giving short note of for the metaplasia most of the time. And atrophy, it causes and type. They are interested in that, so they are asking for that. And yes, from the wound healing chapter, mainly the wound healing, the step for the wound healing, and the primary intention, secondary intention. You have to know at least steps, all the steps, or you can make a flow chart out of it, and you should know all the steps of the wound healing, and you should know at least 5 to 6 factors that affect the wound healing, delay that can delay the wound healing. Okay, you should at least know 5 to 6 factors that will affect the wound healing. Okay, so for that, okay, this much is for the, I think so, I have covered everything. This much is enough for the pathology general block. This will be enough for passing the general block. But you have to not like skip all the topic and read this only, but first be confident in all this topic. यतिमा चाहिँ एटलिस्ट कन्फिडेन्ट हुनु पर्यो, त्यसपछि चाहिँ अरु टपिक पढ्छु भ्याए भने भन्ने तरिकाले पढ. फर्स्टमा चाहिँ फर्स्ट फिनिश all this topic. I have written about 23 questions for the pathology general block. You have to know 23 questions, and it is easy. Like pathology, you can grab the marks easily, because if you write the facts, they will give you marks. There will be no way of cutting the marks. Okay, so you don't have to study like write whole 2 to 3 page answer for literally 2 to 3 marks. Like in anatomy, you have to write, physiology you have to elaborate everything, and it will be time consuming also. But you can grab marks from the subject like pathology, and subject like microbiology, biochemistry, and pharmacology. It is easier to grab the marks because it is a factual answer. Okay, if you like write 2 to 3 points, if you are correct, then you will get the marks. Then it is like that. Now moving towards the pharmacology, we'll do the anatomy at last because it needs little bit of the elaboration. It is short. In short, it didn't have or doesn't have much more questions. The most I think so, मेरो सबसे धेरै bulky लाग्ने is the pathology, and microbiology is also little bit bulky for the general block, and others are okay. And pharmacology, it is bulky. Pharmacology is bulky, but they are questioning or asking the same question repeatedly. It is totally easy to grab marks from the pharmacology also, but you have to study like this. Learn from the, you have to pass out. You may refer to the past year question totally, and you to grab good marks, you have to know everything. And लाइक कि अहिलेलाई चाहिँ पास हुनलाई मात्रै पढ्ने होइन कि जस्ट यु सुड थिङ्क लाइक कि इन द फ्युचर यु हेभ टु युज द्याट नलेज टु ट्रिट द पेसेन्ट अल्सो सो if you are reading the past question, if you are reading the fast track only, you will get passed easily. I can tell you that. But if you are passing easily, but you will fail in the Viva. Totally, you will fail in the Viva if you do not understand the things right. You will fail in the Viva. So Viva fail हुनु मन छैन भने चाहिँ राम्रो बुझेर पढ्नु पर्यो है. पढ्नलाई चाहिँ अब ट्रिक भनेको त्यही नै हो. लास्टमा आएर चाहिँ सबैले पास्ट ट्र्याक क्वेसन नै पढ्ने हो, सबैले फास्ट ट्र्याकबाट रिभिजन गर्ने हो. तर पहिला चाहिँ म्यामहरुले पढाउँदाखेरि चाहिँ स्लाइडहरु राम्ररी पढेको हुनु पर्यो फास्ट ट्र्याक बुझ्नको लागि हैन. पास्ट क्वेसन बुझ्नको लागि स्लाइडहरु राम्ररी पढेको भयो भने चाहिँ यु विल बी गेटिङ गुड मार्क्स अल्सो, यु विल बी गेटिङ गुड रेस्पोन्स इन द फ्रम द टिचर्स अल्सो, यु विल बी नोइङ एभ्रिथिङ एन्ड यु विल बी गेटिङ गुड मार्क्स इन द भाइभा अल्सो है. प्याथोलोजीको भाइभा मेरो चाहिँ राम्रो गएको थियो किनभने मैले सुरुबाटै बुझेर पढेको थिएँ. मेरो प्याथोको भाइभा मस्त गएको थियो है. सो यु विल बी गेटिङ द गुड मार्क्स इन द एभ्रिथिङ एन्ड स्ट्रेट आउटबाट पढ्नु पर्दैन. इट इज सर्ट एन्ड स्विट बट लर्न कि फर्स्टमा चाहिँ सबै कन्फिडेन्ट हुनु है. मैले भनेको टपिकहरुमा चाहिँ कन्फिडेन्ट हुनु, त्यसपछि अरु पढ्न थाल्नु, त्यसपछि तिमीहरुको एक्जाम राम्रो जान्छ है. नाउ मुभिङ टुवर्ड्स द फार्माकोलोजी फ्रम द ADME. We are going from the ADME. From the first question, they are asking bioavailability and its definition and factor affecting the absorption. They are asking for that. And from the pharmacodynamics, one question is sure, either from the biotransformation, either from the target of the drug action, either from the like a description of the target of the drug action, like receptors. They are asking mainly GQ coupled receptor, okay, G protein coupled receptor. From that also they are interested in the GQ receptor. If you don't know the mechanism of all three, GI, GQ and GS, you should at least must know about the GQ, okay. GQ को बारेमा चाहिँ जान्नै पर्यो. And there are some receptor you must know. I will tell you later on. But you should know all the target of the drug action. There is a list of the target of the drug action, like they act in the receptor, they act in the enzyme, they act in somewhere else. And it is a fixed question like the enzyme inducer, microsomal enzyme inducer and microsomal enzyme inhibitor. At least you should know the 5 drugs. Right? 5 drug name for the microsomal enzyme inducer and for the microsomal enzyme inhibitor. Or it can be asked like not like the microsomal enzyme भनेर सोध्न पनि सक्छ, or it may ask like कि cytochrome P450 or cytochrome P50 enzyme inhibitor, enzyme inducer. Like it can act from that point of view also. It is literally same thing. So you should at least know 5 drugs that induce the microsomal enzyme, or at least know the 5 drugs that inhibit the microsomal enzyme. After that, you should know the name of the drug that inhibit the protein synthesis. There is a list of the drug given in the KDT. You should know or given in the slide. You should know at least drugs that inhibit the protein synthesis. At least you should know the names. And aminoglycoside is the fixed question. लेखेर राखेको हुन्छ. aminoglycosides र फिक्स्ड क्वेशन सोधिरहेको हुन्छ. त्यहाँबाट एउटा क्वेशन आउने 100% स्योर हुन्छ. र त्यहाँबाट एन्टिबायोटिकबाट एउटा क्वेशन बिटारेक्टम अथवा त्यहाँबाट एउटा कि रेसनल सोधिरहेको हुन्छ कि चाहिँ के सोध्छ भन्दा aminoglycoside सोधिरहेछ भने aminoglycosideको mechanism of action and area of the aminoglycoside is very much important. If it is not asking in the short question, they will be asking the short note. If they are not asking in the short note, they will ask in the rationale. Okay, it is very much important for the general work aminoglycosides. And other question is like protein synthesis inhibitor. You should know at least know the names. And from the kinetics, elimination kinetics, you should know must know the difference between the zero order and the first order kinetics. It is beautifully given on the fast track. You can refer to that and a little bit add on गर्नु पर्ने छ त्यसमा. Total it is not like the totally satisfying answer is not given in the fast track, so you should add on a little bit from the KDT and literally from the teacher's slide. I think Karma sir have already taught that portion is of the Karma sir. So Karma sir, I think so he have in each slide there is enough written, so you may refer his slide also. And you should also know about the therapeutic drug monitoring and the dog response curve. You should know, at least have idea about that. And if you don't have idea about the drug response curve, you will be having hard time learning about the antagonism, agonisms, and the drug interaction. Drug interaction is very much important. One question is sure from the drug interaction, like antagonism, agonism, and synergistic effect, additional effect, and inhibitor effect. All the effects are there for the drug interaction, and it is mainly referring to the drug response curve, which will be give you the idea of the therapeutic drug monitoring, that lethal dose and the therapeutic dose, everything is given there. So read the chapter. It is very important for the practicals also. So read it it is most important, so read it. Okay, it is it is important, so read it. TDM, therapeutic drug monitoring, is important, I have already told. And also you have to know about the route of the drug administration. You should know at least two advantages and two disadvantages of all the route. It is important and easy also, like IV route, transdermal route, and sublingual oral route. It is easier, no? You can literally tell by using the common sense. Okay, like IV route, what will be the advantage? It will give the 100% bioavailability, because it is like literally putting the drug into the bloodstream. So how much the fraction of drug that reach into the bloodstream in the unchanged form is the bioavailability. So the IV route will have the 100% bioavailability. It's just like a common sense. Okay, and what will be the advantage of the IV route? It is fast, एकदम rapid onset of action हुन्छ हैन, त्यो कुराहरु देखिहाल्छ। त्यसो IV रुटमा अब बेफाइदा के होला त? यसो कमन सेन्स लगाऊ। अब त्यसमा IV रुट दिनको लागि के भयो, हाम्रो ट्रेन्ड मेडिकल प्रोफेसनल चाहियो, त्यो एउटा डिसएडभान्टेज हुन सक्छ हैन। IV रुटले दिँदाखेरि ड्रग दिइराछ भने त्यसमा जस्तो हाइपर सेन्सिटिभिटी रिएक्सनहरु देखिनु छ, अथवा अपर्चुनिस्टिक इन्फेक्सनहरु हुने चान्स, सिरिजहरु दिँदाखेरि त्यहाँ इन्फेक्सन हुने चान्स हाई हुन्छ भन्ने कुरा लेख्न मिल्छ हैन। जस्तो अब त्यसमा चाहिँ अर्को कुरा के पनि लेख्न मिल्छ डिसएडभान्टेज भन्दाखेरि, तिमीले इन केस कुनै पनि ड्रगको एडभर्स ड्रग रिएक्सन देखाइराछ भने इन्ट्राभेनस रुटबाट दिइरहेको ड्रगले त र्यापिड एडिआर देखाउने भयो नि त, त्यो कुराहरु लेख्न मिल्छ हैन। त्यस्तो कुराहरुले चाहिँ इट इज इजी टु राइट अबाउट द रुट अफ द एडमिनिस्ट्रेसन। यु शुड एटलिस्ट नो टू एडभान्टेज एन्ड टू डिसएडभान्टेज अफ all of the route of the administration. Like IV route, they are asking for the IV route and transdermal route and oral route mostly. Okay, for the you should also know about the clinical trials. You can read about it and write it in short, because they are asking clinical trials also in the short note. And most important, from the antibiotic, you should know the beta-lactam antibiotic. Its classification is most important, and cephalosporin classification is also important, and mechanism of action of cephalosporin, they are asking for that. And for the rationale, one rationale will come from the beta-lactam, that one antibiotic is given, beta-lactam antibiotic is given, and the another is the type beta-lactamase inhibitor. Okay, that enzyme inhibitor that will break down the beta-lactam ring from the antibiotic, the bacteria that produce the beta-lactamase enzyme, that will inhibit. So that one, that rationale you should know है। त्यो रेशनल पढ्नु जुनमा चाहिँ एन्टिबायोटिक दिएको हुन्छ। एन्टिबायोटिक दिँदाखेरि चाहिँ के गर्छ, ब्याक्टेरिया विल सेक्रेट द beta-lactamase enzyme to destroy the ring of the beta-lactam ring of the antibiotic. So the antibiotic will not have the effect on the bacteria. But if you give the beta-lactamase inhibitor, or another drug with the beta-lactam antibiotic, it will have it will work, no? So it will, the beta-lactamase inhibitor will inhibit the beta-lactamase enzyme, so it will not destroy the ring, beta-lactam ring, and the antibiotic can perform its function. So it will work. So read about that rationale. It is very important. And the cotrimoxazole, rationale of the cotrimoxazole is important. So read about that too. Okay, and read about the cephalosporin classification and mechanism action is important. Read about that. And I have already told microsomal enzyme inducer and microsomal enzyme inhibitor. At least know about the at least 4 to 5 example of the microsomal enzyme inducer and the microsomal enzyme inhibitor. चाहिँ जान्नै पर्छ है। त्यसपछि for the receptor, I have already told about the G protein coupled receptors, and you should be knowing G protein coupled receptors and ionic receptor and ionotropic receptor, and you should be also be knowing about the JAK-STAT receptor. Okay, these three are important because they are asking it frequently. And penicillin classification, I have already told, and cotrimoxazole combination, you have to read about that also. And for the and you have to read about the teratogenicity in the anatomy. है यो एनाटोमीको लागि पढ्नै पर्छ. इट इज गिवन इन द फास्ट ट्र्याक, भेरी मच ब्युटिफुली गिवन इन द फास्ट ट्र्याक. यु मे रिफर टु द फास्ट ट्र्याक फर द teratogenicity. And there is given like in the anatomy portion, it has been given in the last page of the embryology. It is given in the left side. There is given in the left side in the older fast track that it had been given so short and sweet. It has been given there, so refer to the fast track for the teratology, teratogenicity, and that you can write both the same answer. You can write in the pharmacology, and you can also write in the anatomy. It is like sure short question for the teratogenicity. Okay, there are some drug given, there are some virus given, like rubella virus that can cause heart defect. There are some like enzymes given, or there are some hormones given that will cause defect. And there is the given the what will lead to the susceptibility to the teratogenicity. There is definition. You must read it from there. It is given in there. So teratogenicity को लागि फास्ट ट्र्याकबाट पढ्नु इट इज बेस्ट देयर है. त्यसपछि if you have I think you put on I am not sure, but if they have taught you about heart therapy, it is important. Okay, heart therapy, it is important. HAART therapy, it is very important. And I have already told about the combination of the sulfomethazole and the tryptomethoprim and the cortimoxazole combination. You have to know about that. And the one beta-lactam antibiotic and another beta-lactamase inhibitor combination is important. It is also important. So it is there is like a trick. If you don't know about the beta-lactam antibiotic, if there is ending with the silin in the last, if they are asking the rationale, है rationale सोधिरहेको छ, लास्टमा silin छ र पछाडिपट्टि चाहिँ it is given like it tam, लास्टमा चाहिँ tam छ, beta-lactam जस्तो छ भने पछाडिपट्टि tazobactam हरू छ भने मोस्ट प्रोबेबली त्यो चाहिँ के हो बिटा ल्याक्टामेज इन्हिबिटरको रेसनल हुन सक्छ कि चाहिँ त्यसले चाहिँ त्यो जस्तो बोर्डर मेकानिजम अफ एक्सन बनाउनको लागि, बोर्डर मोड अफ एक्सन बनाउनको लागि दिएको हुन सक्छ. त्यो कुराहरु चाहिँ हेर्नु पर्यो है. त्यसपछि फ्रम द एडीआर भन्ने टपिक पढाइ भयो होला है. फ्रम द एडीआर यु शुड बी नोइङ द टाइप अफ द एडीआर. देयर आर लिटरली एबीसीडी F, there is the type of the ADR. You should know about them, and 1 to 2 example of them. One example is okay. You can read the example, one example of each. You must be able to explain, at least in the layman term. You have to explain like A for the augmented, B for the bizarre, C for the chronic, D for the delayed. Like this, you have to know all the names for the type of the ADRs, and you should also know the examples of the ADRs also, at least one example of each. And okay, from the sources of the drug is also important, and I have already told sources of the drug is important. At least know the chart that is given, at least know 5 to 10 sources of the drugs that we can get, from where we can get the drugs. Okay, and from the biotransformation you should know the biotransformation is very important question है. यो र माइक्रोसोमल इन्जाइम वाला क्वेशन चाहिँ स्योर सर्ट क्वेशन, दे आर स्योर सर्ट क्वेशन, hot topic question, they are hot topic question. So you should know about the biotransformation and the mainly fate of the biotransformation, like conjugation, glucuronation, acylation, acetylation, and you should know about them and which drug go, at least know one example of each. Okay, 1 to 2 example of each type of the fate of the transformation. Biotransformation, it is important. Biotransformation अथवा त्यसलाई मेटाबोलिजम पनि भन्छ, त्यो चाहिँ very much important. It is very much important. And you should know about the definition of the pharmacodynamics and pharmacokinetics. It is important है. त्यसपछि okay, you should know about the drug response curve. I have already told. And it is okay, antagonism, and about the competitive and non-competitive antagonism. It falls under the drug response curve. Therapeutic drug of monitoring also falls under drug response curve. You should be knowing about, at least know about the topics which I have told. It is this much is for the pharmacology. Pharmacology is this much. The question are not being frequently asked from the like chemotherapy. What I say. To the chemotherapy, I know it is hectic to learn about all the chemotherapy at once. You will be get heck of it just like reading carefully. If you read from the starting, you will be getting it easier. But at last, you have to read it at once. It will be hard for you to read the chemotherapy portion, all the drug like aminoglycoside, antibiotics, and all of that. It will be harder. But at least know the important topic I have mentioned earlier. And I will be giving you this PDF or handwritten or okay, and written, because I am little bit bad in writing. I have written here, so I will be given you PDF of that. I will type it and give you the PDF, so you will be getting the all the questions or topics. So don't worry about it. Like you should watch about the description, how you will write, from where you can read. Watch the video from start if you are joining in the mid of the session. So moving on to the in the pharmacology, we have around 21 to 22 questions, and in the anatomy, anatomy is very interesting topic. It is like fixed. It has some fixed questions, so you should be knowing them. Okay. From there are three portions in the anatomy you are reading in the general block. They are like at first you will be reading the general. Okay, you will be reading the journals, which you will learn about the histology and general anatomy. Okay, general anatomy, in you will be learning about the plane को बारेमा पढ्यो होला हैन, टिस्युहरुको बारेमा, इपिथेलियम हिस्टोलोजी को बारेमा सबै जेनरल को भित्र पर्छ है। हिस्टोलोजी स्किन बोनहरु हैन, मसलहरु है, सबै पढ्यो होला। साइनोमेल जोइन्टहरु है, त्यो सब कुराहरु चाहिँ के गर्छ, अनि न्यूरोग्लियल सेलहरु, दे अल फल्स under the general. There will be two questions fixed from the general block. General को पनि general भित्र general anatomy भनेर ब्लक छ, त्यो ब्लकबाट एउटा क्वेशन 100% fixed, and from the genetics one question is 100% fixed, and from the development one or two question is 100% fixed. Okay, it is like a pattern त्यही हो कि anatomy question बनाउने pattern, it is the same pattern. They are asking from years to years, 10 to 20 years, they are asking in the same pattern. In the boards also they will be asking in the same pattern, so it is fixed. Like genetics बाट एउटा question आउँछ 100% fixed, and from the development you will get a one question 100% fixed, take it written. Okay, 100% fixed एउटा genetics बाट आउँछ, एउटा चाहिँ development बाट आउँछ, and you will getting 2 to 3 questions from the general block. If they are asking for the short notes, you will be getting 2 to 3 questions. If they are asking from the for the short questions, you will be getting 2 questions from the general block. And talking about the questions, you will be getting like from the development, like it is like a story. You should, like, way of the reading the development is like you should read the teacher's slide first. You should be knowing the topic, and secondly go home and read at least take one look for the animation, short animation, 2 to 3 minute animation. They are given in the YouTube. You can search for it. Like if you want to read about the spermatogenesis, there is the animations, and if you want to read about the like oogenesis, there is the animation. If you want to read about the blastulation, gastrulation, first week of the development, second week of the development, third week of the development, and new relation of the new relation, you have to read. And you should know about the foldings of a little bit about the foldings को बारेमा पनि अलिअलिसम्म थाहा हुनु पर्छ. And for now, for exam point of view, reading up to the new relation is okay. Reading up to the new relation and placenta formation is totally fine for passing the exam. Okay. Firstly, from the development, first thing you should read like placenta, and development of the placenta is fixed question from there. If they are asking from the placenta, it is fixed development of the placenta, and abnormalities of the placenta like placenta previa, placenta primi, and multiple placenta. There are different terms for that. And abnormal placement of the placenta. You should know, at least know the names of the abnormalities and little bit description about the abnormality, and you should know about the development of the placenta, how it there are different type of villi, 3 type of villi from the maternal side and from the like fetal side. Okay, you should at least write like this. Definition, you should be knowing the standard definition of that, and you should be knowing first it is developing from this layer from the maternal side, like residual layer, residual basalis, and all the layer you have to write. And from the fetal side, there will be formation of different changes there will be happening, and different villi formation, primary, secondary, tertiary villi will form there. Like different between them, you have to write everything, and ending with at last they will anchor and form the discoid shape. Okay, there is a one line definition of the placenta. You have to know, right? It is the and you at last you have to write, at least if they are asking for 1 marks, you have to write the name of the abnormality. You don't have to like describe the abnormality. If they are asking for 2 marks, right, they have to little bit describe the abnormality and at least know 2 to 3 abnormality of the placenta. Okay, and first question we are reading in the embryology. First question is the placenta and abnormality of the placenta. Okay, and second question is like fertilization and fate of the fertilization is important question, very important question. And if Anwar sir had taught you about the fertilization and fate of the fertilization, it is your question. You should be knowing that. And one question from the gametogenesis and spermatogenesis, you should at least know the steps of the gametogenesis and spermatogenesis, and you should at least know the difference between them, how like sperm or ovum, how they the formation of between them will be different, right? त्यसमा चाहिँ डिफरेन्स के हुन्छ है, and you should be knowing about the otid and different thing. It all forms gametogenesis. It is important, both of them are important and easier पनि छ यो चाहिँ हैन. And you should be knowing neural crest cells derivative. It is known in the fourth germ layer. There are, it is beautifully given on the fast track. You may refer to the fast track or embryology, Langman embryology. There is a table. There is around 21 to 22 derivative. You must know 10, at least 10 derivative of the neural crest cells. And you should know about the neural tube formation, neurulation, granulation, and blastulation. A whole embryology is important, but you should at least focus on the like fertilization, focus on the fertilization, focus on the gametogenesis, focus on the neurulation, and focus on the like the second week of the development is also important. Okay, like you should read it like a story. So जसरी read गरेर घोक्न चाहिँ के घोक्यो भन्दाखेरि न्यूरुलेसन घोक्यो, त्यसपछि gametogenesis घोक्यो, त्यसपछि प्लासेन्टा फर डेभलपमेन्ट अफ द प्लासेन्टा. एन्ड लाइक न्यूरुलेसनलाई चाहिँ अर्को तरिकाले कसरी सोध्न सक्यो, इट मे आस्क लाइक कि फर मेकिङ okay, for making it harder for you, like they may not ask like right the process of the neurulation or neural tube formation. They will not like ask like you that they may ask like embryological basis of anencephaly, prosencephaly, or spinal bifida. Like write the embryological basis. So you have to write about the development and a little bit about the how the closure, improper closure अथवा closing भएन भने चाहिँ त्यो neural tube को closing भएन भने that will lead to what, anterior side lead to what, and posterior side closure of the posterior side lead to what, त्यो चाहिँ लेख्नुपर्छ. जस्तो spinal bifida and anencephaly, prosencephaly, they are different applied aspect. You must know at least applied aspect. If you are reading the anatomy, first know about the process, and applied aspect is totally important. It is like 1 marks. Like in pathology, they ask for the definition, they go for the definition, and in the anatomy, they ask for the definition sometimes, but they mainly go for the applied aspect. Okay, applied aspect is like केही पनि आउँदैन भने it is applied aspect लेख्यो भने 1 number is sure. Okay, if they are asking 3+1, you will get 1 marks easily from the applied aspect. So don't leave the applied aspect. At least write the name of the applied aspect. Okay, from the genetics. Genetics, first you have to make a chart of the chromosomal abnormality, and there is kind of like mutation को टाइपहरु छ, त्यसमा एनुप्लोइडी, पोलिप्लोइडीहरु छ, छुट्टै छ है. एन्ड म्युटेसनमा पनि फ्रेम सेम म्युटेसन सबैहरु, एडिसन डिलिसनहरु सबै लेख्नु पर्छ. There is it is given on the fast track, it is given nicely, but if you refer to the notes, I will also provide you the note of the solution of all the question I have mentioned, but it will take some time, so don't totally depend upon me. If I get the time, I will do it for you, but I am trying my best. I जति पनि time दिइराछु छु, so I have my classes running also, so I have to focus on that also. So यसमा चाहिँ mainly Down syndrome, right? Down syndrome and the prenatal diagnosis of the Down syndrome, and you should know a little bit about the karyotyping because they may ask it as a short note ma sodhira huncha karyotyping कहिलेकाहीँ. And you should be knowing the classification of the chromosomal abnormality. You should be knowing the classification of the के भन्दाखेरि classification of the chromosomal abnormality को बारेमा चाहिँ जान्नै पर्छ. त्यो चाहिँ it is most important है. त्यो चाहिँ जेनेटिक सर्च गर्यो भने त्यो सोच्ने चान्स एकदम हाई छ. कि चाहिँ सिन्ड्रोमहरु सोधिरा हुन्छ, कि चाहिँ क्लासिफिकेसन अफ द के सोधिरा हुन्छ भन्दाखेरि क्लासिफिकेसन इज दे आर आस्किङ फर द क्लासिफिकेसन अफ द क्रोमोसोम. अब त्यसपछि जाम जेनरल एनाटोमीमा. द भिडियो इज बिकमिङ अलिकति लेन्दी भइरहेछ है. मैले अलिकति छिटै सकाउन खोजेको थिएँ, तिमीसँग पढ्ने टाइम अलिकति कम होला भनेर है. सो फ्रम द जेनरल ब्लक, जेनरल एनाटोमी, दे आर आस्किङ फ्रम एटलिस्ट वान हिस्टोलोजीबाट सोध्यो भने कि चाहिँ एपिथेलियम सोध्छ, कि चाहिँ मसल सोध्छ, अनि न्युरोन अथवा यता के भन्दाखेरि यतापट्टि हाम्रो नर्भस सिस्टमबाट नर्भस टिस्युबाट कि चाहिँ एउटा न्युरोनको बारेमा सोधिरहेको हुन्छ कि चाहिँ हाम्रो के सोधिरहेको छ भन्दाखेरि न्यूरोग्लाइयल सेल्सहरूको बारेमा सोधिरहेको छ यु शुड बी नोइङ एटलिस्ट यु मस्ट बी एबल टु राइट सर्ट नोट्स अन द न्यूरोग्लाइयल सेल्स एन्ड यु शुड बी नोइङ द क्लासिफिकेसन अफ अल द इपिथेलियम है इपिथेलियमको क्लासिफिकेसन थाहा हुनु पर्यो अनि अर्को कुरा के भन्दाखेरि you should be knowing like important epithelium like pseudo stratified and transitional epithelium. You should be knowing in detail about that and don't forget about the basement membrane. They are acting like basement membrane. Basement membrane हालिदिन्छ. Basement membrane there is short description given in the innervation. You should be knowing about the basement membrane. है okay basement membrane को बारेमा थाहा हुनुपर्छ है. You should be knowing about the basement membrane. Basement membrane बारेमा थाहा हुनुपर्छ. basement membrane सर्टकटमा सोधिरहेको हुन्छ. अनि अर्को चाहिँ भनेको मोस्ट इम्पोर्टेन्ट क्वेशन स्किनको लेयर र त्यसको डायग्राम सहितको लेयर. You should be knowing about the layers of the skin and you should be knowing the description also. It is given in the fast tag. If you want to read it short, it is given in the fast tag. You may read there from there and from the layer of the skin they may also ask you to draw the layer of the skin. Okay, you should be knowing the layers of the skin and you must know how to draw the layers of the skin and like CLGS BG there is some mnemonics है कलेजहरु BG छ भनेर सम्झिँदा नि हुन्छ CLGS BG from the for the layers of the skin and for the muscle they are literally asking all the muscles skeletal smooth and cardiac muscle. If they have to ask all three at a time they will ask for the difference. If they have to ask individually they will ask for the short note on the cardiac muscle, histology of the cardiac muscle and histology of the skeletal muscle, smooth muscle they are asking. But they are mainly focusing on the long bone also. They are asking for the long bone also and joint बाट चाहिँ synovial joint आयो भने from the synovial joint it is important question from the synovial joint they may ask the definition of the synovial joint, characteristic feature and diagram of the synovial joint like all axis movement हुन्छ. There is presence of the synovium membrane and there is presence of the synovial fluid and everything. There is the cartilage. Okay, there is articulating cartilage. You have to write everything and draw everything. Okay, so synovial joint you have to know at least know the definition of the synovial joint, at least know about the characteristic features of the synovial joint and you should know the types and example of the at least 2 example of each of the type of the synovial joints like pivot joint, saddle joint. Okay, everything ellipsoid joint, everything, every type of ball and socket, every type of joint you should know. At least know the name of the joints, type of joints and at least you have to know about the के भन्दाखेरि you should at least you have to know about the type and example of the joints चाहिँ थाहा हुनु पर्यो. at least त्यति चाहिँ थाहा हुनुपर्छ है. अब लगभग it is I think this much is okay for anatomy. You should know about the classification and you should if you have time you just anatomy मा चित्र बनाइदियो है. if you should know the figure of each and every figures. Okay, important for the anatomy. Figure is important for anatomy. If you know, if you are good at drawing, at least spend some time to draw. If you are bad at drawing, you should learn the like short and sweet rough diagram बनाउँदा पनि त्यो एक्सप्लेन त्यो जुन चाहिँ तिमीले बुझाउन खोजेको कुरा चाहिँ एक्सप्लेन गर्ने डायग्राम बनाइदियो भने you will get marks easily in the anatomy. But you have to write a little bit explain चाहिँ गर्नै पर्छ anatomy को लागि. अनि आजको लागि यति नै. this much for today है. As I just I tried explaining you what to read first from the anatomy, pathology and pharmacology. I will be providing you all the questions by like in the digital format or if I will not get time I will be providing you the photo of literally I have written in rough copy. I will give you that. त्यही प्रोभाइड गरिदिन्छु मैले. अनि मेनली मैले भनिरहेको सुन है. मैले भनिरहेको के भन्दाखेरि यो चाहिँ तिमीहरुको पास्ट क्वेशनको आधारमा मैले के क्वेशनहरु छानेर निकाले हो यो है. यस्तो होइन कि फेरि पढ्न भ्याउँछ भने सबै पढ तर पास हुनको लागि चाहिँ एटलिस्ट यदि पढ्यो भने चाहिँ पास हुनसम्म चाहिँ हुन्छ एस्योर हुन्छ कि तिमीहरु पास हुन्छ भनेर सबै मैले भनेको पढ्यो भने पास चाहिँ हुन्छ. त्यति कुरा चाहिँ एस्योर हो. तर अब एटलिस्ट पास मात्रै भएर हुँदैन हैन. त्यो पास हुनलाई मात्रै पढायो होइन नि त. त्यही भएर जस्ट टेक नलेज बेसिक नलेज हुनु पर्यो. सबै कुरा थाहा हुनु पर्छ है. At least अब यति भइसकेपछि it will be easier for you to pass. Like I am not telling you read only this. First finish this. If you have time then go on the other topic. Right? First be confident on this topic and for the drive I will give you access. Now अब यो लाइभ इन हुने बित्तिकै म तिमीहरुलाई एक्सेस दिइदिन्छु त्यसको चाहिँ है. At least please है यसलाई चाहिँ I will like to request you something for at last in of this live stream. Just be sure to like, share, and subscribe. I am giving some effort, so I hope you all will appreciate that. Okay, I am really working on this. I will be typing all the questions and I will be giving you all the topics that are important for the for your exam point of view only. Okay, you at least read this topic, you will be much assured about passing. And if you know how to write and if you read all the topic I told, you will be good. Okay, सो प्यानिक हुनु चाहिँ पर्दैन, आनन्दले पढ्दा हुन्छ है। लास्ट मिनटसम्म पढेर चाहिँ कहिले पनि सकिँदैन। इक्जामको हल अगाडि बसेर नै पल्टाइरहेको हुन्छ मान्छेहरू कपी। सो दिस मच इज ओके फर नाउ, नट टेकिङ मच टाइम। Okay, share this video to all of your friends and let them also know. This is literally pattern for that all the TU college को लागि चाहिँ सबैको लागि सेम प्याटर्न हो। द क्वेसन इज सेम फर अल द TU कलेज प्याटर्न चाहिँ एसएससीको प्याटर्न गर्नु खोजिरहेको हुन्छ। एन्ड दिज आर द इम्पोर्टेन्ट टपिक फर द anatomy, pharmacology and the pathology. We have finished 3 subjects today for the IBMS and we will be also finishing the 3 subject tomorrow. I am collecting the question, I am analyzing the question, but and I am shortlisting the important questions. So thank you so much for watching. Ani make sure कि सबैजनाले ड्राइभ को लिंक पाओस्। if you are not getting the link, if you are not have the access of the drive link, just DM your class CR है, क्लासको CR DM गर, डाइरेक्ट मेसेज गर र भन्नु कि मेरो यो इमेलमा चाहिँ एक्सेस पाएन भनेर। बिकज आई हेभ if you have fill up that form, I am giving the access to all of you है। त्यो फर्म भएर जति सबैले एक्सेस पाइरहेको छ, एटलिस्ट बी स्योर टु सब्सक्राइब है। 1000 पुग्न आँटेको छ, 1000 चाहिँ पुऱ्याइदिनु। आजको स्ट्रिमले 1000 सब्सक्राइबर पुग्यो भने आई विल बी मच ह्याप्पी है। मोटिभेट नै हुनु पर्यो नि त केही न केही हैन, तिमीहरुको लागि यति गरिरहेको छ। सो ओके, दिस मच फर टुडे। धेरै टाइम नलिकिन है। This much for today and okay, thank you so much for watching है। सबैजनाले जोइन गरेको जति 44 जनाले हेरेछ। ओके, थ्यांक यू सो मच फर वाचिङ। अब कसैले अलि लास्टमा आएर हेर्न खोजिरहेछ भने यु क्यान वाच इट फ्रम द बिगिनिङ, इट इज पब्लिक। सो विल बी देयर विल बी द पार्ट 2 of this video. So we have to focus on the biochemistry, microbiology and physiology. We will focus on it tomorrow or day after tomorrow if I will get time है। राम्ररी पाएँ भने मैले चाहिँ त्यो हालिदिन्छु। डोन्ट वरी अबाउट द एक्जाम है। पढ्न चाहिँ पढ, राम्ररी पढ। एक्जाम विल गो लाइक फ्लोमा जान्छ कि एक्जाम अनि एक्जाम दिएको गर्दाखेरि गइ नै हाल्छ। ओके, थ्यांक यू सो मच फर वाचिङ। सबैजनाले सेयर गर्नु, सब्स्क्राइब चाहिँ गर्नु, 1000 चाहिँ पुऱ्याइदिनु है। मेरो क्लासमा 100 जना छ, सबैलाई सब्स्क्राइब गर्न लाउनु। अब घर मम्मुवा हुन्छ नि, मम्मुवाको फोन सुतेर पनि गर्नु है, नट लाइक द्याट। ओके ल, इफ यु एप्रिसिएसन त हुनुपर्छ कि हरेक कुराको है, मोटिभेसन त चाहियो नि त हैन। ओके, थ्यांक यू सो मच फर वाचिङ। 1 घण्टाको भिडियो भयो, आज चाहिँ सर्टै गरेको है। ल बाय गाइज, बाय बाय। आई एम एन्डिङ द स्ट्रिम, बाय है। शेयर इट विथ अल अफ योर फ्रेन्ड, एटलिस्ट फर द फरेन स्टुडेन्ट, एटलिस्ट हेभ अ लुक अन द topics है। I will be providing you the both the solutions and both the questions. Okay, at least read that है। दुईटैको सोलुसन पनि दिइराछु छु मैले, दुईटैको क्वेशन पनि दिइराछु छु। एटलिस्ट read that to pass the exams है। पछि गाह्रो नहोस्, they will not let you to sit in the final exam if you don't pass the all the 3 blocks. Okay, general, MSK and the CNS you should pass. Okay, and CNS is hard, MSK is also like hectic, so it is much bulky, anatomy is much bulky in the MSK. So you have to score good in the general block. It will make much easier regarding your cut-off marks. Okay, so focus on the question first, and then if you have time, read the others. And first, to pass the exam, first focus on this topic. I will be providing you both questions and solutions later on. You will be getting. Don't worry. If I am giving you will be getting. Okay. If I get the time, I will do it as soon as possible. Okay, before your exams. So if you have any doubts, you may comment it. So I will look for it and I will make a separate video है। अनि मैले लाइभ गरिरहेको छु, मलाई किन भन्दा अप्ठ्यारो भइरहेछ कि सबै रेकर्ड गर्न, त्यो गर्न, म्यानेज गर्नलाई। अब मेरो एक्जाम सकिसकेपछि चाहिँ रेकर्डेड भिडियो आउँछ, त्यसपछि चाहिँ अलिकति भिडियो क्वालिटी विल बी मच बी इम्प्रुभिङ। अहिले चाहिँ लाइभमा चाहिँ के भइरहेछ भने ठ्याक्क आयो अनि सजिलै चाहिँ त्यो भनौँ न सबै कुरा म्यानेज गर्न अलिकति अप्ठ्यारो भइरहेछ। सो बाई बाई गाइज, अब गुड नाइटै भन्ने होला। गुड नाइट, राम्ररी पढ, पुरै रातभरि उठेर पढ्ने काम चाहिँ नगर्नु, अलिकति चाहिँ सुत्नु, 2 देखि 3 घन्टा 4-5 घन्टा जति सुत्नु छ आइन्दा सुत्नु है, पढ्न चाहिँ पढ्नु राम्ररी। ओके बाई गाइज, बाई बाई। सेयर इट, सब्सक्राइब चाहिँ 1000 चाहिँ पुऱ्याइदिनु है, 1000 चाहिँ पुऱ्याइदिनु। 900 समथिङ थियो, 50-60 च्यानलले गऱ्यो भने 1000 पुग्छ। साथीहरूलाई भन्नु सब्सक्राइब गर्नलाई है, आफ्नो घर भएको दाइ दिदी हुनुहुन्छ भने भन्नु। ओके, it will be motivation for me. Thank you so much for watching guys. Bye bye bye. Suck you 45 views.